about a common topic for everybody in the world. It's about hay fevers or asthma. Some people, progress to asthma, but hay fever basically is what I'll talk about. And the medical term is allergic rhinitis. And so we know what allergies are. Allergies usually start out by something that gets into your body through some part of you, through your nose most of the time, but it could be your eyes, your skin, your mouth. And these allergies are these allergens rather, most everybody doesn't have a reaction to them in a way that will make you feel sick or start sneezing and having itchy watery eyes or nose, watery nose. And um, however, some people, when this happens to them, these allergens, which could be from, usually a lot of people are allergic to some type of pollen or some sort of grass or weeds, but also, other things like dust mites, like tiny particles like from the cats and the dogs because they might touch their feces. So it's really their feces. So when someone say, "Oh, I'm allergic to cats," usually it's because the cats touch their feces, and that's what humans become allergic to. And the same with the dogs. And of course, there's smoking, like tobacco, but even making wood fires or barbecuing, those kind of fumes can also irritate your mucous membranes and cause a reaction, like an allergic reaction. And then there's gas fumes or exhaust from the cars. And of course, some medications or drugs can cause allergies too. And then there's also insect bites and some plants that when you touch them, they cause an allergic reaction in some people. So we can consider really the nose when we talk about allergies. The nose is basically like a window to your lungs because that's where everything gets in. And the allergy or the irritants that affect your mucous membranes and cause all these other type of inflammation that has, give you the runny nose and the sneezing and all this, the same type of cells also line your lungs and your mucus and your bronchial tree, like the trachea all the way down is as your how would I call it? I don't want to use medical terms. I want to talk so we can all understand. But basically, the tubes that lead to your lungs, and it's the mucus is very thin and has a lot of fluid because this is what actually prevents us from getting sick with viruses and bacteria, which are also types of allergens, because it will continuously, by the movement of the tiny hairs, try to remove these things from your airway so you don't get sick. So we'll talk about what actually, like the medical, I'll give you a little medical background as to what actually causes this runny nose, sneezing, watery eyes, red eyes. And this is usually caused by a basic immune response. Your body's trying to protect you, so it mounts an immune response by sending these special kind of cells that we call like antibodies, and they're made by your white blood cells or your plasma cells, and these are protectors of your body, like, so they're the guardians. And whenever anything comes in new, like all the diseases that we hear about, like COVID or HIV or anything, the body will mount its own response to try to protect and heal itself and to prevent you from getting sick. So your immune system is very important. The nose allowing things to get in, uh, tries to protect itself, but when they pass through those mucous membranes and the nose was not effective in preventing the entry or any other part of your body, okay, not just the nose, but we'll focus on the nose today because we're talking about uh, hay fever. So what happens is that the human body has five um, antibodies that we make with a lot of subclasses. And they're IgG, we call them immunoglobulins. So there's IgG, IgA, IgM, IgE, and IgD. Now, the one that mounts the response to allergens is called IgE. So it's immunoglobulin E. And this immunoglobulin it works similar to all the other ones, except that it's mass produced when certain allergens come into the body. And let's see. Okay, so sometimes some people, if you will notice, like all year long, everything's going good, and all of a sudden the tree starts blossoming, or there's a lot of pollen, and all of a sudden you start getting sick, and you just don't understand. You were just fine, and then all these, all of a sudden this happens. So usually a person, like most people, allergies can come at any time. Some people are born with a lot of sensitivities to foods like milk or any other kind of foods. A lot of food allergies, nuts. But then there's some people who were fine all along, and now they are 22, and all of a sudden they start having this kind of, we call it rhinorrhea, with the runny nose, the coughing, the sneezing, and they're not really sick, because sometimes when they go indoors, it will go away, or it will go away until they pass that particular tree again, and they don't even realize it. So important to know with allergies, something important to know is that you should pay attention to what it is that causes your allergy. So if it's like, for me, myself, I'm very allergic to cigarette smoke. And if I go into a place, like into a home, because I do hospice care and I go to people's homes sometimes. And if I go into a home, and even though they're no longer smoking, but they were smoking, and the smoke, sometimes I don't even smell it. But then I start having runny nose, watery eyes, and I will ask, anybody ever smoked in this house? And sure enough, usually that someone has smoked there before, or, whether a long time ago or recently. But these allergens can hang around and still affect you later. So let's see. So now that you know that you have allergies, of course, you're going to pay attention to what causes your personal allergy. And then you're going to know that, this thing that causes the allergies, we call it an antigen, because that's what the immunoglobulin will recognize whenever it comes into your body. So the first time it happens, you may just have a small response because your immune system is trying, but it has never recognized this as an allergy before. So it doesn't mount a big response. But the second time, when you are exposed to this, the immune response will be so large that there'll be lots of these cells. There are lots of cells that cause the response, with the swelling and the runny nose and the stuffiness. And all these cells will now head to the area, because of course the allergen came in through your nose, most likely. So they go in that area, and because of all this infiltration of these cells, you get the swelling and you can't breathe, and I know it feels very miserable. So of course, if you have allergies and you're feeling miserable, we're going to have to find a way to treat and help you to feel better, right? So sometimes, of course, there's always regular medicine. But today, because I like alternative medicine, I'm going to talk about complementary medications with alternative medicine. And we have a name for that, actually. It's CAM. So it's complementary and alternative medicine treatment. So as far as seasonal allergies go, one of the big things that we can do is that we can, the first thing that we should do if we have a lot of allergies, especially to things that we can't get away from, like, if you're allergic to cigarette smoke, don't go around people smoking, or don't, if you're smoking yourself, you got to stop, or make sure that people, wash their hands and don't touch things that you touch, because even leaving the residue of these allergens can also make you sick. And then, of course, there's dust in everybody's house, everywhere we go, no matter what. They're dust, but it's actually the dust mites that make you sick. It's not the dust itself, but these are the mites. And they attach to your sheets, your pillows, your clothes. So if you have a lot of allergies and you notice it's happening more when you go to bed at night, maybe you have to get a new pillow, or you have to wrap your pillow in a plastic before you put a case on, so that way these mites can't cause you to have an allergic reaction. And then, of course, also you should keep your nasal airway clear and clean. One of the best way to do this is to use normal saline, we call it, like a saline hygiene. And of course, it will also help you to prevent you from getting sinusitis, because a lot of people who have allergies because of all this swelling in the airway, if you don't clear it, the mucus can cause a plug, and then people end up with sinusitis. So if you have a lot of allergies, and you can tell people with allergies, they usually have a line across their nose because they're always pushing up on their nose like this. So if you see people with a line, like just a mark right across their nose, you can be sure that they're allergy sufferers. And what they need to do, especially if it's reoccurring very often, is to do the nasal saline washes to keep your mucous membrane clean and clear. And so I found this whole thing about how to mix a saline solution at home. You could buy the one that's sold over the counter, because they have saline moisturizers. They have a lot of things, especially in the pharmacy, that you can buy. But of course, you can make it at home, and it's just as effective. So you can just, they say, take, it's 1 tablespoon of regular salt and a pinch of baking soda in a pint of water, preferably distilled water, of course. And you just put this in a clean bottle or a glass, and you mix it up. And if you have a lot of allergies, each time when you wash, they say you should try to use at least 1 cup. So you wash and wash until you wash clear with 1 cup. You don't have to do this every day, because of course that will be time consuming. And also you have to be very careful that you don't inhale it and get it into your lungs. So the way that they say you can do this, one way, simplest way, is to put some into your hand. So you just pour some of the water into your hand, you block one nostril, and you just snort it like you're snorting. Just pull it up into your airway, and if it will go down like to your throat, and then you can spit it out. Okay, but don't let it go down into your lungs. So you have to stop your breath, hold one nostril, and then just pull up and hold your breath once it's in your airway. Don't let it go into your lungs. You can feel it as it's coming to your throat, and then you can just spit it out. And you do that over and over with each nostril, and then you blow your nose until it's clear. And usually, if it's allergy season, that would probably keep you clear, most likely, for the day. However, when you have a lot of debris, because like other things are going in, and the hairs in your nostril, it's like moving them down, and we get what we call boogers, or sort of small amount of sticky stuff. And sometimes they get so hard that you can actually pick them out of your nose. That will also be a breeding ground, and the allergens will stick to that. So that's why you need to keep the airway clear. And of course, let's see, we can talk about some other things that you can use. Of course, most times if you run to the doctor before you try the home remedies, the thing they're going to give you are steroids. And steroids have a lot of bad side effects. But if you're having a great big allergic reaction, like what we'd call an anaphylactic reaction, then you're going to definitely need to use steroids. So if you're trying the home stuff and you see you're getting worse, you need to get some steroids. I don't know if they sell it over the counter in Jamaica, but here you have to get it as a prescription. Then, there are also other over-the-counter stuff that you can buy, like pseudoephedrine, and this will help to prevent the congestion. It's like a decongestion. And then there are antihistamines, which are like now they're very popular: Allegra, Claritin, Zyrtec, and of course Benadryl, the all-time favorite. Now Benadryl has the effect of making you very sleepy, so that's not one we want to use in the daytime. The others we can use in the daytime. But remember, if you're using the antihistamines and you use pseudoephedrine as a decongestion, don't use that at nighttime because that will prevent you from sleeping. Those two together will cause you to have insomnia. So if you're using antihistamines, just be careful that you don't use the pseudoephedrine at nighttime. But pseudoephedrine is a very good decongestant. It's sold over the counter. And also, there's some other things we call like mucolytics. So that means they cut the mucus. Like, let's see, like some of the nose sprays have them. Uh, like nasal crumb. I don't know if you have that in Jamaica, but there's some other nasal sprays like Afrin. That's a popular old one. But the only thing about these is that you should not use them for long term because after a while they do not work anymore. Also, there's cough medicines because a lot of people have a lot of coughing that's related to this, and the coughing, I don't know why, but most times it's at nights that it gets to be the worst. And maybe because at night you're quiet and you're not moving around. But some dextromorphin, cough medicine is also good that you can buy over the counter. And then also for the runny nose, if it's too bad and you've tried all the home remedies, I'll talk about some more in a minute. Then your doctor will probably prescribe you something like a nebulizer or a nasal spray that's by prescription, like an Intol or albuterol or something of that sort. And that will prevent you from getting. Hi. Oh, okay. Will prevent you from getting mucus plugs. Um, okay. No worries. All right. Sorry about that. Okay, so the worst case is like for some people who have allergies to nuts, like peanuts or tree nuts, you have to sometimes see an immunologist and they will give you like immunotherapy, which is really desensitization. So they'll give you a small amount of allergens and slowly desensitize you. So you can actually not have to be in anaphylactic shock when you actually get this allergen in your body again. Anaphylactic shock is like the worst reaction to an allergy. And also, I wanted to talk a little bit about the fresh treatments that we can use, of course. That's our favorite. And they call them bioflavonoids. And I'll just give like the names. I'll name them out because most of us know them. We've used them. Eucalyptus. We've used eucalyptus since we were young. Our mom put it on the pillow at night. But of course, other good things are onions, garlic, cayenne pepper, apples, fever grass, we call it feverfew, yarrow, skullcap, and all the mints and chamomile, and some other ones that you probably know as well. And one of the favorite and the best, I think it's ginger or turmeric root, which is very good for allergies. They say you make the tea, and as you sip on the tea, let the fumes go up your mucous membranes, and that will help to decrease your allergic reaction. Also, essential oils that you can use in a diffuser, and they say orange, tangerine, lemon, cardamom, cinnamon, and the mints. All these will help to relax the airways. So if you have, you can make your own essential oil as well. There are plenty of YouTube information on that. And so if you make your own essential oil and you put it in a small diffuser and use it in near your bed at night, that should help as well. And also for the children, that's a good one. And of course, they also say if you have a lot of hives, which is also part of this allergic reaction, you can get a rash like blotchy, itchy skin. They say stinging nettle oil is the best for that. And one of the best things that I could do to encourage anyone who has a lot of allergies is to drink a lot of water. Because actually, they find that the more hydrated you are, the less likely you'll get sinusitis. And because when you're having runny nose and watery eyes, you're also losing fluid, and it will also keep you hydrated, and your lungs will be happy, and your lungs do not like to be dehydrated. So always stay well hydrated. Eat a lot of fruit and veggies. And then there's omega-3 fatty acids. That's also good to prevent allergies and to treat allergies. And some of the things that we can do, of course, we can avoid getting getting the allergens into our bodies during the pollen season or whatever it is we're allergic to. We have to find a way to eliminate them as best as we can, because overall, even though we can get medications, we can use these things, the best thing is not to get it into your body. So my advice and my take on this is to remember that avoidance is the best therapy. But if it happens, at least you know there is a way to get relief and release. And of course, I read in one of I read in a little notebook that I saw that we should never forget that laughter is, after all, the best medicine. So for any kind of illness that we have, including allergies, they say, and they have done some studies actually that shows that people with allergies, if they laugh a lot, their allergies do get better.